be live. So let me also check on
Good
Facebook
evening
because
and welcome to a special presentation of TVBAKWETU. I'm your host this evening, Frank Seleki, and I am joined by special guest this evening, Professor Roma Chilengi, and also our Dr. Ali Kinkoma, who was with us a few days ago. So, good evening, both. How are you this evening?
Good evening, Frank. Good evening, Roma. And good evening, viewers.
Thank you, Frank. Good evening, and good evening, Dr. Nkoma. I'm fine, thank you. And how are you?
Very well, thank you. Thank you so much, Professor Chiang, for taking your time. I know at the moment it's very, very busy, and it's nice for you to come and join us on TVBAKWETU today. It would be very nice for the people to know what sort of work you've been getting up to the last few weeks. What sort of work has been going on into ensuring that the rollout of the vaccine is going to be a success? Professor.
I've been I've been on. Can you hear me okay?
Yes, we can hear you. Yes.
Hello?
Hello, we can hear you. I think he might be struggling with his signal at the moment. Are you still with us, Professor? Right, we're just going to move on to something else while the professor sorts out his signal. We're going to move on to a different. We're going to move on to a different topic while the professor sorts out his signal. First of all, actually, I'm going to ask Jerome because you are in Zambia. First thing, how do you think the vaccine rollout is going, and how are the general public taking it?
Yeah, thank you, Frank. The rollout of the vaccine actually is going very much well, and the people have received it so well, such that wherever the facility or center you go to, you find there are queues of people wanting to get vaccinated. Today, I managed to go to some few centers in Indola, and I saw a good number of people, even around 16 hours, people are queuing up to get vaccinated. I think for me, that's very much encouraging, and we are going to reach the target that have been put in place for us to vaccinate 2 million people within 30 days. So far, I think we have a good response from the members of the public, which I'm very happy about.
That's very nice to hear that there's been a response. And what are people thinking now with the strategy that has been taken by the government in terms of asking that people have to have vaccines in order to access public properties, essentially? What is the mood in the country?
Okay, I'll leave the prof is back. I think I'll wait for Prof
Yeah.
Chiangi maybe to come, since maybe this time it's his network is now sorted out. Prof, please, your floor is yours.
The question was, what have I been up to on my job? I've been basically focusing on the COVID mitigation plan at national level. That meant really reviewing the strategies as they'd been proposed by Ministry of Health, trying to separate what needs to be done now and what can be done later, but most importantly, trying to unlock the various financing mechanisms for the things
think we've lost.
That we need to do. And I think that the first big thing that we worked on was the relaunch of the vaccination campaign on the 7th of October. And I think that by that time, the vaccination program in Zambia back in April, by October, 3% of the adult population, not the general trivial really. So we had to relaunch the vaccine campaign. And I think that gave it a bit of momentum. We've been constantly pressurizing for more vaccines to come in country. And I think right now we have enough doses in country. But we also succeeded at reaching a mechanism for accessing support from USAID, from CDC, from World Bank, UNICEF, and others to support the vaccination campaign activities. And unfortunately, while we prioritized the vaccination campaign in the period when we've had low case positivity rates, we now faced with the fourth wave. And so it has really strangled us because we need to also begin to prepare for the treatment side of things, not just the prevention side of things. So we were hoping we'll probably get to January or thereabout with the window but I think with the coming of the Omicron and the case rise in the region, it begins to show us that the fourth
I think we've lost you again, Professor. I think we lost Professor. I think the kind of some few things that are going on in there in what he has mentioned. So there's a big strategy now. There's a big campaign, a big push in order for them to do a lot more about vaccination. But at the same time, there's also a strategy that we need to ensure that we are able to combat the fourth wave. Dr. Nkoma, what would be the first thing that the hospital management and the Ministry of Health need to look at in terms of preparing for the fourth wave?
So thank you, Frank, for asking me to join your program again. What is needed at the moment is to strengthen the clinical front in case this Omicron virus will be causing a lot of illness. We don't know if that will be the case yet, but nonetheless, we should have learned from the past 3 waves to make sure that we have healthcare workers trained. Mainly issues are, the number of nurses, and we need to recruit the nurses that were unemployed and provide them with the training so they can attend to patients should that happen. The second thing is, the things which were in short supply, including basics such as oxygen. There are some oxygen plants at different hospitals which might not be working, and that has been the case over the past 3 waves. Those need to be fixed. And people should have central points in the different provinces or districts where they can actually have an ability to refill oxygen cylinders. So those are from the, that is from the oxygen front. Again, we need to train community health workers, including, what, used to be the case in the past as with clinical officers, because some of the patients with coronavirus can be treated in the community. So people need to have access to basics such as, steroid inhalers. We know that if you have a steroid inhaler in that can prevent you from becoming very ill to require admission and therefore require oxygen. So we need to have community health workers trained to do that. But obviously it is about case finding as well in the community and isolation to prevent further spread, because what causes problems really in the management of these patients is the sheer numbers that visit our hospitals. And on the last front, it's about an ability to deliver a critical care service which patients can access and can be helpful to patients. We know that we had a shortage of beds in the different big hospitals. Are we going to have other hospitals opening up their facilities? Is there a way of us buying and airlifting ventilators should that be required? I think this is an emergency. If we have the same numbers as on the previous, especially the last one, then as we discussed in the last meeting, we basically on a war footing. We need to prioritize how we can manage the treatment of unwell patients. So I think that is what is required. We've got different groups in Zambia that have been providing the training for critical care, but we also have members from GAZEP in the diaspora who are able to assist with the training of colleagues on critical care management. So we need to harness all our resources locally and in the diaspora to provide that. So Professor Chilengi is here. He needs to understand that we are available from this front.
Thank you very much. I think we lost Professor Chilengi once again. Jerome, I think we got his Professor back. Professor, are you able to pick up on what Dr. Nkoma was talking about?
Please say that again.
Are you able to pick up on what Professor what Dr. Nkoma was talking about? So what are the strategic plans you've come up with combating the fourth wave in terms of hospitalization and ensuring that the staff are trained to use the equipment and that there's equipment?
Right. So I think what we've been doing in the background is firstly identify the facilities. As you would recall from the third wave experience, we didn't have sheer bed space to accommodate the patient. So with a few new hospitals and frontline COVID centers, earmarked and specific furniture in terms of bed space and basic equipment being put in place to expand the capacity for what would be designated frontline COVID facilities should we get the outbreak. And I think the biggest challenge we had in the third wave was twofold. One was the human resource. We don't have enough human resource, and this is a real problem. So some of our cooperating partners and supporters in WHO and World Bank have actually agreed to hire additional healthcare workers who may be available, either retired or not yet in employment, hired to support it's called healthcare human resource research. In case we have a resurgence, we need additional human resources. So we have quite a number of additional hands that have been hired as temporary consultants and are being trained to manage COVID. These will be nurses, these will be doctors that may not already be in the system. I think the other big basically that was another problem we suffered from. It has happened now is that we've had experts visit these earmarked facilities to review where there are non-functional oxygen plants, have specific recommendations around that. But in essence, we've also secured funding support to be able to install in the major COVID facilities large oxygen production plants, and in the smaller facilities, the moderate sized PSI units, basically to the extent that in Lusaka would have at least 3 large plants, on the Copper Belt 2 large plants, and the rest of the provinces 1 moderately sized plants in each of the provincial centers, and a few district facilities scattered around having moderate
I think we have lost. I think we have lost the professor again. I think he's having a little bit of problem with signal. So are you able, Dr. Nkoma, are you able to pick up, just explain a few things that he's talking about there?
Yeah, so I think what he's trying to say is that they are trying to, they've got cooperating partners to hire more staff, and that is from the retired and the health care workers who were not employed. So if we're talking about healthcare workers who were not employed, who have just qualified, in my opinion, those are not the ones you need to be deploying in the front line of COVID, because you need training and experience to manage complicated unwell COVID patients. If we are going to use those healthcare workers to deploy in the community, obviously that is well and good when people have got relatively mild to moderate symptoms. So we need to have I think what I would suggest is that we need to have a different strategy to redeploy our frontline staff if we are going to face the same crisis as we did. Because doctors from different specialties might be easier to adapt to training to manage these unwell coronavirus patients. But in any of these hospitals that exist, including critical care, you need extra pairs of hands, and that might be someone to give a patient water or someone to feed the patient, because most of our healthcare system in Zambia, really the nursing is done by relatives. In the time of COVID, obviously, we have realized that that is not the best way of practicing medicine, because we cannot let relatives by the bedside. So if you only have a few nurses, they're not going to manage to give a patient food or water, or make sure that the patient is still connected to oxygen, or monitor that patient to make sure they've got good oxygen saturations, and if need be, put that patient on a ventilator. So I think we need to have a strategy of redeployment of staff if that's what we're going to experience again. And then I think he's back now. He was talking about putting up infrastructure to purify and supply oxygen in the hospitals. So big centers or big oxygen plants, and smaller centers, smaller oxygen plants. We know that within our sub-region, our other countries are doing better. So in Uganda, I understand that each hospital has got its own oxygen. As far as I'm aware, the oxygen plant at UTH has not worked for a while. So we need to get that sorted. I don't think it is acceptable that this can be non-functional for more than a year. So we need to prioritize some of these issues. And I think, we need to change the pace at which we do things.
Thank you. Jerome?
Yeah, I think somehow I agree with the Dr. Nkoma on some of the measures that he has mentioned. But one thing that we need to know is most of the bigger hospitals, the way they were made like it is very easy even to put up an oxygen plant there. So it's just a matter of trying to check and find the funding that can go into making some of these oxygen plants in the hospitals. For example, we have Kitwe in Dollar Central here on the Copper Belt. We have also Mansa Central. They should have something, UTH. So there's something where we can start from. But yeah, anyway, let's hear from what the prof is going to say since he's back on network. Let me
Professor,
let me
Professor, you mentioned about staff redeployment. So are we trying to get qualified staff, newly qualified staff, or are we going to get experienced staff and redeploy them to required areas? What is the strategy?
I'm sorry I didn't, because I've been, whether it is my internet or is the system, I'm not sure, but I think I've cut out of the conversation like 5 times now. So I didn't get the bit of the last conversation.
Yeah, so the question is, Dr. Nkolma raised a point. Are we going to redeploy? Is a strategy to redeploy experienced staff to departments that require them the most, or is it to employ new qualified staff to go and help out on the front line? What is the strategy? I think he's having terrible time with network there.
Yeah, Frank, as we are waiting for him to get the network back, I think what we need to consider as we are trying to say recruitment for staff, for especially for the frontliners, I think we need to know very well that frontliners does not mean that it's only doctors and nurses. We have people who are working in the laboratories. They are also frontliners because if it's them, they are not there to produce the results or to do the testing, you discover that you'll not be able to have to know exactly what's happening. So we need also to consider also other health professionals as we are trying to put up the numbers for the frontliners, because most of the time I've seen that when people say we are recruiting frontliners, health workers in Zambia, they mean they are recruiting doctors and nurses, which makes again the work to be very difficult because each health professional, they have a law they need to play during the time of COVID. And this resulted in us having a big challenge in fighting the COVID, especially the third wave. I liked one thing that Dr. Nkoma also mentioned to say we need to make sure that we train also the community health assistants. I think that's another area which we are lagging behind in terms of us realizing or actualizing what we need to have. I was just reading yesterday that in Philippines, if I'm not mistaken, they have a target of vaccinating 9 million people in 2 days, and from there they have trained about 160,000 community health assistants. So you can see that
It's a
they
massive target.
play a
It's
big
a
role.
massive target.
Yeah, they play a big role, and from there we can also learn something. And yesterday I had a chat with one of the doctors actually when I was at Ministry of Health, where I mentioned to say the numbers you had in the previous wave, if you only know how many people were buying the drugs that people were seemingly considering to help in the fight against the pandemic, I think you learn and know that we had more cases than the cases that were captured by the Minister of Health. So we need maybe to sit and see how best we can re-strategize this time and move in one accord so that at least we can have accurate information as compared to the way where we had not accurate information last time. Because if you check very well how much antibiotics were sold in private pharmacies in the third wave, you get shocked. How much vitamin C's and other drugs were sold, you find that it is something that you get shocked of, because at one time we even had shortages of some of these medications. But when you see the cases which were reported, you get worried to say, but how can these cases create shortages of drugs and all that? So this shows itself that people had the COVID, but they couldn't they couldn't go to the hospitals to get tested for it, but they decided to treat themselves. So now we need to sit on the table and rethink and bring everyone on board and see how can we follow up a person who comes in a pharmacy where I'm working to want to buy the drugs that are seemingly are recommended for COVID, so that we can send people can go test these people at their place, home, and all that. Because most people, provided they are feeling okay, they are just deciding to start medications by themselves.
So then that brings up another question. Really, is information. I think there's been a lot. I think I did a program on Monday, and I was quite vocal about my disagreement in the stance that was taken by the government in terms of how the information was, and I still stand by that. There's a lot. What is a lot of info? How are we informing? First of all, I've got two medical people. I'm the only non-medical person, and I would like to get a different opinion. Dr. Nkoma, what is your take on the stance that has been taken?
So obviously, what I do express is my own opinion. What government does is, they get opinion from other experts. I'm an expert in my own area, but not coronavirus and its control. Obviously, I've got a good understanding of it. What we need to do is not necessarily what the West has done, like the UK and America, to say, you are not going to come to this place if you do not get the vaccine. So that tends to feed into conspiracies. What we need to do is convince our people to get vaccinated. And as I said last week, the reason for vaccination is different this time. When we had the first wave of the virus, and then when we had the second one, we had a different virus which was easily responding to the vaccines, which came around the time of the second wave. But with the beta virus, the Delta virus, and Omicron now, obviously we don't know much about Omicron. We know that these vaccines don't necessarily stop you getting infected. If that happens, it only happens for a short while, and then you are still able to infect other people with the virus. So you cannot say that you don't come to this place, because if you're not vaccinated, you're going to infect other people. Even if you are vaccinated, you can still infect other people. And therefore, the question of herd immunity induced by vaccination, has really gone up in the air. That's what we thought initially would be the case, that if we mass vaccinate people and then we shield the vulnerable people, those who are immunosuppressed, the elderly, those of us that will be vaccinated will have that layer of immunity surrounding them from other infections. But now we understand that even if we are vaccinated, we can still get an infection and pass that infection to those people. So, and that is what is explaining the different I mean, the outbreaks we're seeing this side of the world in America and Ireland, and mainly in mainland Europe. Now, the difference that this vaccine has brought really is that it's for the benefit of the person who receives the vaccine. And what that does is that it does prevent serious illness in the majority of the people who become infected. And with that, it does prevent death. So what is the benefit to the wider community if you do that? So the benefit to the wider community is that you will not get a lot of patients getting admitted to the hospital and therefore taking up space. So if you clog hospitals with patients, the system is not going to cope to manage those patients. That is the benefit of mass vaccination. And we individually as citizens need to take that responsibility, because if we become unwell because we've neglected vaccination, we might end up in hospital, and we might become very ill and will die. So that would deprive us as a family, breadwinners, and as essential workers to the healthcare system. So if you work in the healthcare system and you are an expert in something and you get demobilized by COVID, that is a disservice to the community. If you are a teacher, if you are a nurse, if you are a driver and you become unwell, your illness will directly affect the economy. I think that is a message that we need to get to our people. It's a different message that politicians and other people are delivering. But this is my understanding of this illness. Certainly, we've had high numbers this side of infection. That number of infection has not translated to the number of admissions we had in the first, second, and third wave. So that is the benefit of vaccination. And the other issue, which again I alluded to in the last time I was on your show, was that we also need to inform people that if you've had this infection, you are as good as someone who has had the vaccination. So very few people are talking about that. Now, if we're talking about that, obviously we're talking about individualized medicine. If you are facing a pandemic like this, the public health approach is vaccinate everyone. So I think that is the right approach, because you cannot prove, unless you've had a PCR test, that you've had an infection or if you just had the symptoms. So we need to change that level of debate, because it does feed into conspiracies which are unnecessary. But we understand that this infection is nasty and it kills people. So those who have not been exposed to it in the last few waves will definitely get it, because this virus has come to stay.
Thank you. Thank you very much. And we're joined also by, I think, Mr. Patrick Chilufya. Good evening. Good evening, Patrick. And also we've got Honorable Matiba.
Yeah, good evening, my Frank. Can you get me?
Good evening, Honorable Mabeta.
Yeah, good evening, Frank, Jeremy, and Dr. Ankoma. Good evening.
Yeah. Right, good evening. Patrick, so we've got Dr. Ankoma and we're talking COVID. Any question of what is going on at the moment? Okay, we don't. I don't think Patrick can hear you.
Can you hear me?
Can you hear me now? Yeah.
No, Dr. Koma, I think the question I had for you, I think this question I had, I was going to ask Roma, but you're there. Maybe you can answer it on our behalf. I think what Zambia needs, I don't know whether it's a statement or what Zambia needs is education, because in the UK there was so much resistance to the vaccine when they started, and the government, obviously via NHS, spent a lot of money educating the people. Yeah, so I don't know what strategy would you advise the Zambian government to use in order to convince the people that this coronavirus is deadly, is dangerous. It can affect our economy. It can actually cripple our economy, and because there's a lot of conspiracies from even preachers saying this is the mark of the beast, and some people are saying they've got the vaccine is bad. So what would you advise the Zambian government and the Zambian people, you know, when it comes to vaccination?
So I think what the government has done, include this government and the past, which was good, was that the leaders themselves got vaccinated in public. So the Honorable Minister of Health, then Dr. Jonas Chanda, got him vaccinated in front of TV, and I think the President and the Minister of Health, Masewo, also did the same to get vaccinated. Most of the other sphere of influence in our country are our religious leaders, our pastors, priests, and bishops. I think most churches are preaching to their congregations that citizens need to get vaccinated. There are some of our preachers, obviously, who take a different line. We need to approach them so that we can listen to them and then ask them what their contention is. So this side where these vaccines, not only this side, but the West, in China. So China has vaccinated about 1.3 billion or more, because that is their population. India has done the same. They're not dropping dead. Yeah, the National Health Service where I work has vaccinated more than 99% of its workforce. So you cannot have a system that develops vaccines to kill itself. So we have not made any vaccines in Zambia. These vaccines are donated from elsewhere. We cannot say that these people don't understand what they are doing and want to vaccinate their own people, so they want to kill them. So you cannot be a healthcare worker and develop a vaccine so that you kill yourself. So that needs to be very clear to the Zambian population. We need to tell them the numbers. So China and India are the biggest populated countries in the world, and they have delivered the highest number of vaccinations. So it is not un-Christian to have a vaccine. And obviously, as Christians, we should not, if you cannot, put God on the spot to force God to say, God is going to protect me from death. So the Bible and Jesus was very clear that you shall not put the Lord your God into temptation. So we have been given the knowledge and the technology. We are fortunate to have the technology to vaccinate against infectious diseases. This is not new technology. We eliminated smallpox, when I was still young. Okay, those vaccines were not made in Africa or in Zambia. Those vaccines were made in the West. In Zambia, we've also eliminated polio, and so have many countries. Those vaccines were not made in Zambia. So we cannot, accept to have these myths preached to our population that these vaccines are meant to harm people. As with any medical technology or medicines, these treatments do carry side effects, but these side effects happen in a minority. So that we need to understand. They're not 100% safe. Possibly 0.001 of people might get a side effect with this medication. But that side effect, will be experienced if you're going to take chloroquine for malaria, or if you're going to take antibiotics for a chest infection. You can get any of these side effects, and the side effects might be fatal. So far, in terms of safety of these vaccines are safer than most of the medications we give. We have a large population of our country that is receiving antiretroviral treatment. I appreciate that some of our spiritual leaders are saying, have you tested these medications? None of these medications are made in Zambia, and yet we are giving them to our population. And we know that the rollout of ARVs has made a huge difference to the healthcare delivery in Zambia and to protecting lives. So that is the message you need to get. And I think we need to get it in the local languages and the deployment of community health workers. I think that's what we need to do.
Thank you. Thank you so much for that explanation, Dr. Nkoman. Just so many myths that go on in a country, and wherever you stand, whatever you think about whether you're going to have your vaccines, the first thing, you always make sure that you got the right information. Make sure that you get the information from the right people. I said on Monday, you don't go and get expert from Manachanda Bakona or Shotomato. She never went to medical school. Get the medical advice from the right people who know what they were talking about, who know what they're talking about, and the right information. And don't mix religion with medicine. And it's a thing that we do. When we get ill, we go to the hospital, and we can't. You just have to go to the hospital and get the right treatment. So if you want religion advice, go to your pastor. If you want medical advice, don't go to your pastor, go to your doctor. The doctor will know a lot more. So that is an approach that we need to take. Honorable Maveta.
Yes, thank you. I think this is a very important topic with a lot of challenges, especially back here in Zambia. I don't know. I'll need to engage the doctor to try to understand maybe what could be the real problem we have here is the population. I can say the group of people affected mostly by the COVID. What I've observed here in Zambia basically is COVID affects mostly people who are above 45. Those who've got underlying conditions when they are 45, between 40 and 45, 40 and 50. When you go to 50 to 60 years, that's where we lost a lot of people in that age group, especially above 60 to 70. And knowing that my majority of, I can say 80% of the population here in Zambia that below 40 years, how can we get this message to a group which don't seem to appreciate that we have this challenge coming in our communities? This is the reason why you've seen maybe when you go on social media, look at the statistics on social media. 80% of people on social media, those who are not most affected by COVID. So obviously they're going to react badly when you try to bring them a message which they don't seem to appreciate. So how can we segment message so that maybe target to the right people and it's accepted by the people who are mostly hit by the COVID-19?
Yeah, so as we understand, most of these conspiracies don't arise from Zambia. So there are some people in the West or elsewhere who make these videos and they cut and paste, different information to confuse our public. And we need to be confident in ourselves. We've got our own experts in Zambia. They are the ones we should listen to. It does not necessarily mean that if someone has got a different color and they come from a different continent, that they understand these things better. So we've got our own healthcare professionals in Zambia. We've got the Ministry of Health with the Public Health Institute who have delivered these messages to our public. We know what interventions work. With the first wave, we did very well. As soon as we got cases, we had a lockdown, and that wave disappeared very quickly. The last two waves, obviously, were caught unaware because we seem to have ignored that message of social distancing, wearing masks, and washing hands. But with the Delta virus, which is a predominant virus at the moment, we know that a lot of younger people have also died from this virus. So young people in their 20s, pregnant women. So those have died in Zambia and elsewhere if they catch this virus. So there is no guarantee that you're young in the 40s, that you are going to escape with this virus without side effects. And then there is a concept of long COVID. We don't know what the long-term effects are of getting this virus infection. So that is one thing. But more so if you've got a severe form of it. So what should we, what education should put to our people? That, we need to, have confidence in ourselves and the healthcare institutions we've built, and the different governments, where the last one or the current one have got professionals who are advising us in the population to say, this is what we need to do for our people. So there's no guarantee that if you're in the 40s, you're not going to die. Obviously, the high-risk population, as you rightly said, with the first wave, we knew that if you're above 55, but that is here, this side, where the healthcare system, has got more facilities, more equipment, and you readily get oxygen. You cannot get on a ventilator and you recover. Where there's no oxygen, obviously, a lot more people will die. The other risk, obviously, if you are overweight or if you've got diabetes, that on its own is a risk factor. And so that is what we need to understand. So we need to devise a message probably in the local languages, but as I said, we need to use our traditional authorities as well, pastors, and traditional leaders, the chiefs. They need to tell the population and they need to advise the population to get these vaccines, so that they don't become ill and risk death.
That's a very, very important. Honorable Maveta, what I would be very interested to know is, so in Kankoyo, in Muflera, how is the message being sent? How is that message being sent to the people? Is there a way to make sure that people actually understand the message that is being given to them? Who's delivering that message?
Yeah, believe me, Frank, before we had the second wave, I personally engaged myself. We had a mobile system where we went announcing the message. Before I got the COVID myself, when I got the COVID, to date, there's still people who say that was the political COVID. It wasn't the real COVID. They just don't believe that there's COVID. We've had families who've lost their loved ones within our community, but still more just to accept that was COVID. It's so difficult. I don't know, maybe it's because COVID was quickly politicized, so it has become so difficult for people to see the real part of it. There is still a lot of stigma. When you have COVID, you're stigmatized. So many people wouldn't want to talk about it. Even when there's a family which could have lost a family member due to COVID, they will try to hide it, and that also increases the risk of spreading the virus. When you're wearing a mask, you're seen to be like someone who's trying to look down upon those who don't have a mask. So there's so much resistance and rejection of having this virus around us. So it's been a very difficult process to just get a message synced to the people, more especially the young ones. They strongly believe there's no COVID. But I think the risk comes when we become a carrier. You could, as the doctor said, you could not react so strongly to the effects or to the illness of COVID, because maybe your immune system is better than someone who's got a weaker immune. So you carry and pass that virus quicker to the people at more risk of having the COVID. So the risk of infecting, when I carry you've got the COVID, but it's in a passive state, you can easily pass it to someone else because you're not careful, you've rejected it. So it's quite a challenge. COVID is a serious challenge in our country because there's no acceptance, and there's this myth to say no, Africans, we are stronger naturally because we take a lot of okra which has got soda. There's excuse to everything, not wanting to accept. So it's a serious challenge for us.
Wiseman, good evening, my brother. No, he's not. He's not.
Frank, just
Hello?
to chip in, Frank, just to chip in, you see, I've seen most people are trying to ask and trying to say if these vaccines are tested by the Zambian health workers or by the Zambian scientists. You see, I'm failing to understand exactly what the people mean. Because if they say a Zambian, I'm a Zambian practicing in Zambia, and I'm a Zambian health worker, and I'm a Zambian pharmacist trained by the Zambian University. I'm telling the people to say, please, can you get the vaccines? The vaccines are very much safe. And all the tests have been done on the vaccines according to all what is needed to be followed. But I don't understand whom they want to listen to. So it's something that is very cumbersome in the way people want to do or believe. They want people to, some people want what they are thinking to be like that's the way it's supposed to be, but that's not the way it's moving. Today, as we are talking, Nigeria have also put a mandatory vaccination for all health workers. Is it the way even here in Zambia it has put to say all civil servants are supposed to be vaccinated? The same thing is not only in Zambia; it is also in Zimbabwe. They have gone the same route, and also not only that, even in South Africa they have gone the same route. We need to understand to say there are some liberties that we do work here in Africa and those that do work in the Western world. But you discover that in Africa, you need to be a little bit radical for you to protect the citizens. Our health facilities, like the Minister of Health has been saying to say, if the numbers goes or gets out of hand, we cannot manage, because we don't have enough resources to fight this pandemic if it gets out of hand. So the best thing we can do now is to prevent. And in terms of preventing, is to make sure that we get vaccinated. Dr. Chilengi also mentioned something here when he was saying to say, look, we are anticipating the fourth wave, and the fourth wave is like here. And the best time to vaccinate people is when you don't have a lot of the cases. So we are running out of time. We need to vaccinate as many people as possible so that we can have more people who will be prevented from being hospitalized or going into severe case, but we just have a mild case. When you have a mild case, it is very easy for the health workers who are treating you to treat you well. They have ample time to find the proper medication for you, unlike when you are in a serious severe case. So these are some of the issues that people want, but I don't understand what people want to hear. They say we need Zambians who are born or whatever in Zambia. We are telling them, but they don't want to listen. So that's a very sad part. When the numbers goes west, they are going to blame the government again for letting the number go to west. Our Indians for now.
I think it's very interesting. There's a point Dr. Nkoma made, I think is very important. We don't manufacture medication in Zambia. Most of the medications that we have, in fact, all the medications that we have are manufactured abroad. Everything that we have, when we are having it, when we feel unwell, every single medication that we have, we make it abroad. So this whole thing of saying it's been made by all these countries to come and kill us. We never make any. If they were going to kill us, they would have killed us a long time ago. But Patrick.
Yeah, but Frank, these myths and questions, even here, but Frank, you remember, you and I work for NHS. When they started rolling out these drugs, there were a lot of questions, especially amongst the black people. And you remember they came up with questions and answers, and we had a lot of we attended a lot of meetings. They explained. My question was, there've been so many diseases and they've never come up with a drug in such a short, a vaccine in such a short period. But they explained that you know, this vaccine was built in such a way that it was an emergency. So government pumped in a lot of money, and not only that, there was a platform already from which this drug was developed. So these are the things that we need to start explaining to Zambians, and also we need to the state, the government, and the health services. They also need to explain the consequences, both to the economy and to the health of the people, for not taking this drug. But Dr. Nkoma, you'd agree with me. What we call flu here, it started as Spanish flu, and it affected the entire Europe. And there was a vaccine, you know, as an emergency, which was brought in, and flu is still here up to now. And then TB killed a lot of people in the UK in the 40s and the 50s. They came up with a TB vaccine and they controlled it. If we don't control COVID in Zambia, you know, viruses mutate. And this is why we are coming up with different variants, Delta, now Omicron, especially with people who are not vaccinated. They will start mutating, and then what's going to happen? COVID will become a problem to Zambia. And no drug will cure it, no vaccine will cure it. When people get sick, no vaccine will work. Not even the immune system will fight it. And these are the problems we're now going to face as a country. We don't have the facilities, and it might even cripple our economy. And then if people are saying vaccines are dangerous, but Frank, when we grew up, we had an under 5 card where all those vaccines were given to us: polio, tetanus, TB, BCG. Why didn't people ask about query those vaccines? You know, we're taking malaria drugs. Have they been tested by the Zambian scientists? People are taking antiviral AIDS drugs, you know, vaccine or drugs. Have they been tested by the Zambian scientists? And not only that, this drug has been approved by World Health Organization, which means it's safe. So I think there is need for education, because like Dr. Nkoma would agree with me. I work for NHS, we double jabbed, and then we also have a booster. And also I got a flu vaccine also. That doesn't mean I won't get COVID. I might get it, but the symptoms will be mild. And also it might also protect me. I'll give you an example which I gave yesterday. 10 days ago, we had our son, who is 9, got COVID in our house. And my wife and myself, we are double jabbed, and we've got a booster. We didn't get it. So the doctor said it's possible that because you've got a double jab and a booster, that's why you didn't get it. But not only that, a colleague was in a similar situation, but they all got COVID despite being jabbed, double jabbed, and a booster. But the symptoms were very mild. So that's the advantage of getting the vaccine. And then there are also studies, I think Nkoma would agree with me, that people who are not jabbed, who don't have a vaccine, when they get COVID, they might have some complications going forward. They are relating some of these complications to diabetes. I've heard people who never had diabetes, but after having COVID, because they haven't been jabbed, they've refused to take the vaccine. Now they've got severe, what do we call, diabetes. Thank you.
Thank you very much. And it's very, very good point. And it's important, people back home, you understand. And we're not saying it. I'm not just sitting here going, go and have your vaccines. I've had mine, and we can only encourage you. We cannot make you. As I say, you can take a horse to water, but you can't make it drink. we can encourage you. It comes with its own benefits. I've seen people who have refused to take the vaccine, but then they've lost their loved ones, and then they've gone into a panic, and that becomes too late. That all just becomes a little bit too late. If you want further questions, don't ask somebody who doesn't know. Go and speak to a professional. Go and speak to a profession to get proper advice on the matter. We're joined by Vom Kelavai. Kimazi Wandat.
Kimanziwani wo Frank Muchwan. My apologies for the video. I'm unable to I don't know. I have a little bit of a technical problem, so I'll just use my audio. Good evening, doctor.
Good evening, Wam Klabai.
And good evening, everyone on the panel, and good evening, viewers. Thank you so much for that clarification and for your insightful professional advice. And I just hope that people are listening. I've listened and I've heard. My today's concern is on the people that are busy going around trying to demonize the government that has put up a measure in trying to protect or prevent people from spreading the virus by allowing people to access certain government institutions when they have upon production of the COVID vaccine certificate. So in my defense, or rather in my support with the government, is that people who are busy trying to put down the government decision, they are making a terrible mistake, because the government's aim and the government's intention is not to kill people. It's not to force people. This is not a law. Many people are saying, no, our rights are being infringed. We are being forced to do this. We are coerced by the government. No, if you don't want, stay home. Don't go. You won't see the police coming to arrest you just because you have refused to take a vaccine. But the government has put their own stipulations, their own conditions. When you come to my office, please make an appointment. When you come to my office, you have to provide the security with the clearance, for example. You know, when you come to my office, come with a COVID certificate, because I don't want you to come and infect our fellow citizens that are working in these buildings. So that is not an imposition. That is just a stipulation that has been given. And if you don't want, stay home. You can either communicate to the government through phones or using the technology today. So the government has not imposed. So my rebuttal is to those that are trying to bring down or to put a blame on the government that is trying to save both their lives and those who are also vaccinated lives. So it is a duty of the government to come up with the rules and the regulations, or not even even regulations, yes, to prevent people from spreading this deadly disease or the virus. So that's my take. Please continue advising people to please go and vaccine, not to start bringing this conspiracy theory that have no backup, no backbone. Let's tell those people who are trying to bring down, talk down of COVID, to please let them be in their own lane. And they are at liberty not to take a vaccine. It's their prerogative, it's their right. But the government has put a stipulation. If you don't want to meet it, stay home. Thank you.
Thank you, Wom Kilawai. And I think we got to be very careful on this. I think something that Dr. Nkoma explained really well this evening it does not mean if you have the COVID vaccine, you're not going to have COVID. It does not mean you cannot spread COVID. So one of the things that we need to take, the government does put a policy in place, but one of the things that we need to take away is the fact that if we're trying to lock away people who have not vaccinated so they cannot bring COVID in, if we're doing it on that basis, as Dr. Nkoma explained it, that is not true. Having a vaccine will not stop you from having COVID. It also will not stop you from spreading COVID to other people. You might not have COVID, but there's a possibility you might be able to spread COVID. So as we encourage people to have the vaccine, that's a message that we have to send. And for me, that's a concern I have with the policy. It kind of seems to imply that if you're vaccinated, then you cannot transfer COVID. Honorable Mabeta.
Yeah, so I think from the government side, it's a huge battle, Frank, we have to face, because the resistance and I can say the myth, as the doctor put it, seemed to make sense to a lot of people. So much that there's so much resistance about the vaccine. I can look at the numbers of my friends around me. Out of 10, maybe only 2 of us are vaccinated. The rest, they reject it completely. So it's quite a huge challenge, especially to the age group of the 40s and below, to accept that the COVID is real and COVID can affect you. Well, you may not get the symptoms or serious conditions, but the after effects of COVID are conditions which are very difficult to deal with. From the time of COVID, I've struggled to talk when I was at school, and that has affected also my contribution in part, because I also have to compete for the oxygen, the fog memory, where you have to struggle to remember things. You may be talking, but you're struggling to recall what is already in your permanent memory. You also have fatigue, endless fatigue. Every morning when I wake up tired because of the after effects, which I don't know when they might clear. Also, the issue of severe flus. I've experienced severe flus frequently where I just so infected with COVID severely. But if I wasn't infected, I wouldn't be suffering with the recovery, the after effects of COVID. So I know it's difficult for the youth to appreciate that COVID is real, but it might be too late. The doctor says variants are coming, they're updating, they're upgrading also. So you have a variant which will be very strong even to resist if you don't have a vaccine. So don't want to take that route where it's too late to control. Let's just get vaccinated. These vaccines are very safe. Ever since I was vaccinated, I haven't had a problem due to the vaccine. The first 2-3 days, for sure, they're a little bit severe, but that was because my body was responding strongly to the virus, which was already it had experienced. But after 3-4 days, I went back normal to my normal life. But the after effects of having had COVID, they might take me maybe even a lifetime struggle to clear them.
Thank you very much, and it's good to have that story. It's good to have those stories, Honorable, just for people to understand that this is not a myth. COVID is real, and it has a lasting effect. So it's important that we take up the vaccine. And as I've said throughout the broadcast, make sure you speak to the right people to get the right information. We've just been joined by another guest. I can't see the name because there's a comment in front of me. Who's just joined us? I can't see the name. I would like to ask you to speak, but I can't see the name because there's a comment.
Oh, hi.
And when the comment, hello.
Francis, sorry, Frank, it's me. It's Beauty Digging here.
Hiya.
It's Nyachi Sengu, let's put it that way. Good evening, everybody. I have a couple of comments to add to what the doctor and Frank and the whole panel has said. I work in a hospital, of course, I'm in charge of employee health and here in Canada. And so I want to add on a few things to do with COVID. When we say somebody's fully vaccinated for COVID, for instance, it takes about 14 days for your body to say you are fully vaccinated from the time you get your vaccine to the time you can say, oh, you are, if you come across anybody with COVID, right, you are protected. It takes about 14 days for you to be fully vaccinated. When you take your first jab, it will take 14 days. And then when you take your second jab, again, give it another 14 days. Why am I saying this? When you get COVID, when you're fully vaccinated and you happen to be around somebody with COVID, you might get COVID, but the symptoms are not going to be as bad as the person that has not been vaccinated. And you will not, sometimes you might not be, because you're already fully vaccinated, you have a chance, you might get a chance of not even being hospitalized or even dying with COVID because you're fully vaccinated, unlike somebody who is not vaccinated. And the other thing that I wanted to say now, I've forgotten. But that's just something I wanted to add. The 14 days after you've received your jab is when you can say you're fully vaccinated. I think I'll let Dr. Alec add to that. Am I right, Dr. Nkoma?
Yeah, so you're right. If what happens that if you get a vaccine against a virus, the vaccine gets into your body cells, and then it teaches your cells that how to recognize your enemy. So that process takes a bit of time, and initially you produce antibodies which are not specific, which we call IgM, and then you after a couple of weeks you produce specific antibodies which we call IgG. So the reason why you get a second dose for some vaccines, except the Janssen vaccine, is that you need to boost your immune system to produce more antibodies. What is happening at the moment is that we have learned that these antibodies tend to go down with time. In fact, as soon as 3 months or 4 months after you had the vaccines, your antibody levels go down. So the suggestion now, which is happening, and studies have confirmed that, is that if you get your booster, your antibodies go up, and therefore, unlike someone who's not had the vaccine or someone who's been vaccinated twice, you are least unlikely to develop symptoms or to get into hospital. So that's the science behind these boosters. So when you do get a booster, you don't get the first antibody, which we call IgM. You're basically getting the specific target antibody called IgG. That's what you produce. So the same happens if you've had an infection in the past. If they give you, the first vaccine, or which might be a booster to you, you produce a lot of these specific antibodies which are specific to that virus. So that's what happens. So the message to our people, as we've said, is this coronavirus infection is going to be with us for a long time. It's not going to go away. If you have not had it, you will eventually get it. What you need to do is take responsibility that at the time you will get this virus, you've had a vaccine on board, so that you prepare your body to fight the virus. So I can talk about an analogy. So if you are going to war, okay, you cannot just lock soldiers in the barracks without doing war games, okay? So if you're going to do war games, you'll be primed to fight the real enemy. And that's what these vaccines do. Obviously, in the first and probably the alpha variant, the vaccine was very specific to those. And if you got that virus, you had that vaccine on board, you fought it very well. Although the enemy has changed slightly, or will keep on changing, but if you've taught your body to fight an enemy of that nature, your body is most likely able to defeat that enemy if you've trained it than if you haven't.
Thank you. Thank you very much. That sounds like the very, very nice point to end. We can't add on to that. And our message on TVBAKWETU this week has just been one message: go and get your vaccine. And I've added on another information to that. If you are worried, if you got worried about the information that you're getting, go and get the information for the right people. This has been a special TVBAKWETU broadcast. We were talking to Dr. Nkoma joined us. We are also hoping to have an in-depth conversation with Dr. Roman Chilengi, who's a COVID presidential advisor, but his signal is not too great. So we got a few things. We didn't get a lot of information that we have, but we've had a lot of information and also a contribution from Honorable Mabeta. And thanks to our TVBAKWETU crew who have also joined in. So don't forget to get the stars. And also, if you want, you can join for £3.45 and become part of the TVBAKWETU family. This has been a special presentation of TVBAKWETU. Thank you so much for joining us. God bless you all and look after you each and every day. Bye-bye now.
Bye.